Hi friends, this is Dr. Abdequaem Chimthanawala. Today I would like to share a case of rheumatism which I cured with one of the very infrequently used medicines. First, let me tell you what were the symptoms of the patient which I took for prescription. Now this patient, when he came to me, he had inflammation of the joint. The joints were inflamed, the small joints and elbow joints were inflamed, and there was deformity also. The joints were deformed and there was a lot of pain, and this symptoms were since about 2 years. He had taken a lot of other medicines but he had no change. So he had come typically for inflammation of the joints which were very chronic and deforming. The deformity is already started. So I asked him about the pain. So he tells that the pain is very severe. Sometimes the pain is cutting, sometimes the pain is very throbbing, sometimes the pain is on touch, sometimes there is no pain on touch. So there were a lot of symptoms of pain which the patient was using. But the one symptom was very important, that was inflammation, and it was chronic in nature, and there was deformity. In fact, when I asked the patient that this joint pain is since 2 years only or before also, so he said, sir, this swelling of joint was before also, but before I had stiffness. There was stiffness in the joints and swelling in the joints, and then gradually the swelling increased, and now since 2.5 years I am taking medicines, but the deformity has started. Till I take the medicine, there is pain is less. So when I stop the medicine, the pain starts again. This was the symptom. And the rheumatic pain in the knees and the rheumatic pain in the hips and the joints were basically aggravated while the patient was walking or when he was in motion. I said something else. So her wife told that whenever he gets up in the morning, there is lot of sluggishness in the body. He cannot wake up. He has to be made to wake up. He has to be told, go in the bathroom, go brush your teeth, then eat breakfast. He is very sluggish in the morning. As such, he is a very active patient. But in the morning, he takes very time to get up and all. So I asked him whether this was because of the joint pains or before also. So wife told, no, sir, this was before the pain also. So you basically sluggish in the morning. Whenever this symptom, a particular symptom, the patient tells you that the sluggishness is especially in the morning, you must remember a few drugs which are very important in this symptom. Those are agaricus, carboanimalis, chelidonium, nitric acid, nitramur, and verbascum. These are drugs which are basically very sluggish in the morning. Gradually then they become active. So this was a very important symptom in this patient also. Now whenever you get acute pain in the joints, rheumatism with swelling and stiffness, deformities and all, we have lot of drugs in our mater medica. We can start with the Restox, we can start the arnica, symphytum, nephilum, goecum, polycrest also, calcaricap, calcarifos, the kalis. All drugs are very important. But here, as it already taken a lot of medicines including homeopathy, so I had to concentrate on these symptoms which the patient was telling and defining the patient. This patient defines the patient. These symptoms defines the patient. So when you repetize these 3-4 symptoms on seeing the patient, I took symptoms of inflammation of the joints, chronic deforming, stiffness and swelling of the joints, rheumatic pain which are aggravated by motion, and the pains are chronic in nature, and definitely sluggishness of the body in the morning. Now those who are using rare drugs also will appreciate that they should have already known this drug which I am telling you. Now if you repetize these 3-4 symptoms, a very very important drug comes in the repertory chart, and this is a very important drug for arthritis, rheumatism, joint pains and all, a very important drug. And the drug that came in the repertory chart was Stellaria media. Yes, Stellaria media, a very very important drug for arthritis, for joint pains, for stiffness of joint, for inflammation of the joints, for deformity of joints. A very very infrequently used medicine, but a very very effective medicine. In fact, if you get sluggishness of the body, especially in the morning, you must think of Stellaria media. Apart from the drugs which I told you, agaricus acid, natrium urine, nitric acid, these are drugs. But Stellaria media, if the patient is complaining of rheumatism, you must think about this drug. So my friends, today you have to go home and read Stellaria media in detail. There are a lot of other symptoms also of rheumatism, but I have told you only those symptoms which I have seen in the patient and which this symptom the patient has cured. So these are my clinical symptoms which I have seen in the patient. Again, you must remember inflammation of the joints, chronic, deforming, stiffness and swelling of joints, rheumatism aggravation by motion, and sluggishness of the body in the morning. These 5 symptoms are very important to prescribe Stellaria media. If you like this video, please do share and subscribe. Thank you.